local cancer survivor says when it comes to drug shortages, right now you need to be your own advocate. Medical reporter Liz Bonis shares his nationwide search to find a drug that appears to extend life, as the FDA says it's in short supply.
Hey there, hello to you. For weeks we've been following one survivor who's had quite a journey finding a drug that is on this short supply list. It is used to treat prostate cancer.
Well, I waited about 6 months from the time that I knew that I needed to be on this treatment.
The treatment is called Pluvicto. Steve Abbott was finally able to get his first treatment by infusion here at Ohio's Urology group. It is what's called a radiopharmaceutical drug made by Novartis, which provided this manufacturing video.
It specifically will attach on to a part of the cancer cell that has a membrane or base layer called PSMA.
Once it attaches to that PSMA target, it can inject the cancer cells with radiation and destroy them. The only problem?
The medication really has been somewhat on shortage since the beginning.
Dr. Brooke Edwards told me the medical supply chain problems were magnified in the pandemic.
Whether it's cancer related or not, we just do not have product many times.
The FDA says at least a dozen other cancer drugs are also in short supply, so doctors are swapping the similar medications if possible, or trying to find the drugs outside the U.S. Steve's treatment had to come from Italy because there is no other like it.
This treatment is very impactful. A lot of advanced prostate cancer treatments kind of manage the condition, but this is showing actual quantifiable extension of life benefit.
So after searching and waiting, here's what Steve Abbott wants others in the same struggle to know.
To a certain degree, you have to empower yourself to ask the right questions to make sure that you're being enough of your own advocate.
He'll know in a few months how well it's working and feels it's every bit worth the effort.
Now, shortly after we interviewed Steve for this story, he actually got a call from the urology group canceling his next treatments. When we followed up, the urology group sent us this statement saying from Dr. Gary Kirsch, the president, that we, the urology group, can provide the medicine as long as it's covered by the patient's insurance. We had a mix-up with Steve, and his is covered. Urology group does not determine if insurance will cover this new groundbreaking therapy, and it varies by payer and is a healthcare system issue we cannot control. Steve has since had all of his future treatments rescheduled, and the team says they will treat others who do have coverage for this drug. I'm medical reporter Liz Bonis. Now back to you.
From Local 12, the weather.